Hey everybody, thank you so much for tuning into the Diana Show. I'm so excited. I've been telling everybody that I come across that I'm going to get to interview Jade Jette, and she is a pelvic floor therapist. Am I saying that right? If you know me, you know I've given birth to 3 children, and even though I have 5, and I don't know anything about this subject. So I'm very excited for my own knowledge and to meet this person and just to learn more about this to see how that could maybe help me gain some confidence in an area that I struggle with. So welcome, Jade. Thank you for being here.
Thanks for having me. I hope I can give you some insight and all of your listeners too.
Yeah, for sure. So can you first start out by telling us at the very beginning what your Instagram is and then what your website is where people can contact you?
My Instagram is at doc.jadejette, and my website is subscribepage.io/irongrace.
Pretend I'm someone who knows nothing about the vagina. I know a little bit about it because I have one, but what does pelvic floor refer to?
The pelvic floor is a collection of muscles at the bottom of your abdominal cavity. So your bony pelvis is kind of like a bowl, and then the pelvic floor is like a hammock at the bottom.
Okay.
And it refers to the muscles and some tissues, and your vagina goes through the muscles. And they have a lot of functions.
Okay. What kind of functions do they have?
Well, it's part of the core musculature. So your pelvic floor works together with your abdominals, your obliques, back muscles, and your diaphragm, which kind of makes the top of the abdominal cavity. They all help drive movement. So every breath you take, every movement, your pelvic floor is working in the background. But the pelvic floor also helps support your organs like your uterus, bladder, your rectum, helps prevent like dysfunction with that, so like urinary incontinence, and helps prevent constipation if it's functioning properly.
Yeah. So what problems do people come to you for? Like what solutions do you offer?
Often people come to me with pain, so they might have pelvic pain with intercourse, they might have hip pain or back pain, or they have UTI type symptoms, but antibiotics aren't helping.
Yeah.
Often they have several things going on. So maybe it's pain, but also like urinary incontinence. Maybe you pee a little bit when you sneeze or when you lift
Yeah.
weights. Constipation is
That's me.
another one. Yeah. Yep. Common, but not normal, and it's totally treatable. So
Yeah. So like what is it, like a quick solution? Is it like tips or is it like a long-term therapy
it's
that you would suggest?
more of a long-term therapy. It definitely takes commitment, consistency to an exercise program.
Yeah.
So it is time consuming, but my goal is that I can make it easier for you, teach my patients the concepts so they understand like how to utilize their pelvic floor when they're moving. And especially if you already have some type of movement practice, we just need to tweak it a little bit to make it more pelvic floor friendly. But at first, it's mostly just learning how to utilize your pelvic floor. And then over time, you just need to be consistent and build strength. So my goal is that after my patients are done working with me, they have some lifelong tools to continue to stay strong and eliminate any pelvic floor dysfunction that may come up.
Why do you think that it's not something that's like the norm? Why do you think it's rare for us to understand what even a pelvic floor is?
Well, it's fairly recent that women were even included in clinical trials
Yeah.
as far as the history of medicine goes. And it's also just kind of a taboo topic in our society, unfortunately. Even a lot of like primary care doctors and even gynecologists sometimes don't ask you all the right questions. Like they might not ask you if you're having pain with sex or if you're having urinary symptoms. But I'm hoping that soon it will be more commonplace to talk about these things.
Yeah. And so women who come to you are struggling with all those things, or could it be just a few of
It could be just one or just a few of them, and sometimes it's all of the things.
I'm not asking for a friend, I'm asking for myself. So if I feel like I'm fairly physically fit and I like to lift weights at the gym and I like to walk, but I do have sometimes problems with incontinence and actually way more often than I would like. And so if I came to you with that, is that something that I would incorporate at the gym or is it something that like I do on a yoga mat at home?
Usually to start off, I give you things that you do on a yoga mat at home, and then maybe some modifications to work into your exercise routine.
Mm-hmm.
First, you have to learn how to relax the muscles, and then you have to learn how to contract the muscles properly. And so those things you work on at home. And then once you have that down, then we can start like working on how to utilize the muscles when you're doing squats at the gym.
Yeah.
So it's not always a separate pelvic floor practice that you have to do, but over time you can just incorporate it into your normal movement routine.
Sort of like getting to know our bodies because we really can benefit by even gaining knowledge in an area that we didn't even know about.
Yeah, sometimes people don't know that they have a pelvic floor, or
Yeah.
often they don't know where it's at or what it feels like to contract it. Maybe you've heard of Kegels and you've tried them before, but you're like, I don't really know if I'm doing it right.
Uh-huh.
And actually, it's really common for women to have tight pelvic floors, and so they don't actually know how to relax it, and they're always in a constantly contracted state, and that also causes dysfunction. So just like improving your connection to that area of your body, your awareness and coordination is like the first phase of therapy.
How did you know whether you are like overly contracted or not contracted enough?
Well, based on your symptoms, so if you have pain, that's often a sign of over contraction or tension. You can get a pelvic floor assessment by a physical therapist. So that looks like an intervaginal exam, just a finger inserted, not a speculum. So it's a little bit less uncomfortable than the gynecologist. Or you can use your own hand and feel those muscles and take some deep breaths and notice if the tension changes with breath or if they just stay tight all the time.
Do you feel like, did you always know you're like, you were a little girl and you're like, I want to be a pelvic floor therapist?
No.
No. No. How did you get into it?
Well, I was having a lot of hip pain myself. I played water polo for 10 years,
Oh,
uh,
okay.
collegiately, very competitive sport. And then I started doing CrossFit after they closed all the pools for COVID. And then I was really having a lot of hip pain when I was like running and lifting heavy and jumping. And the orthopedic things that I was learning in school were just not really helping. So I was like, there's a missing piece here. So
Yeah.
I went to a pelvic floor therapist. I was referred by one of my professors at school, and she helped me a lot. And I think maybe I have an overuse injury, like a labral tear in my right hip, but with just pelvic floor therapy, I was able to treat it and not have any symptoms with running or jumping anymore without doing like a surgery. And
Yeah.
so
That's so
I
good.
found the missing piece, and now I
Yeah.
want to spread the word.
So you went through it yourself and then you got interested. What kind of school do you have to go through for that?
Well, to be a physical therapist, you need to have a doctorate. So I went to undergrad for 4 years and then a 3-year doctorate program to become a physical therapist. And then I started taking continued education. Like I took an
Wow.
elective at school and then I took some courses through the American Physical Therapy Association. Then I got a certification for level 1, then level 2 pelvic floor therapy so I could see patients and put this stuff into practice.
Yeah. Can you think of a patient that you had that you really saw a big difference in what she was able to achieve with getting some help?
I have a patient who's postmenopausal and she came to me with pain with sex. She told me she doesn't really have a sex drive anymore and thought that it was just part of aging. She had some urinary symptoms. Like she was a therapist as well. She does talk therapy. So she couldn't make it through a session with a patient without feeling like she needed to go to the bathroom. And she had some fear of movement because she was just diagnosed with osteopenia, which is like the precursor to osteoporosis. And so she didn't want to be lifting anything heavy. But after we worked together and I taught her about her pelvic floor and we desensitized some of the areas that were causing pain during intercourse, she realized that she could have sex and could have a sex drive still without any pain. And now we're getting into some lifting. So she's doing like squats and deadlifts and using her pelvic floor and her core properly to support her body while she's doing these things. So that patient is doing really well now and she's lifting without fear and without pain. And I don't play favorites, but she's one of my favorite patients because we've come so far and worked on so many
Yeah.
things.
I love that. I love a job where you get to help people feel more confident. And that umbrella can be over hairdressing, it can be over what you do. there's so many ways to do it, but it is such a beautiful thing to work with someone and then see them be like, oh yeah, because to lose your sex drive or your ability to have sex, your ability to do your job because you can't hold, especially if it's something that someone like you could come alongside her, support her, and help her get the help that she needs. And I coach on and I speak on confidence a lot. And I feel like this is a very, very big area where it's like this small breakdown of things that start happening to women between what happens with menopause, what happens with our periods, what happens, as our bodies age, knowing that, like you said, I've just was started reading recently about how, there haven't been a lot of clinical trials or a lot of money thrown at what goes on with the female body. It's hard to feel confident when it's like we haven't been shown that we matter that much, So it's important to take steps and surround ourselves with people that make us feel like, hey, this matters. It does matter if I don't have a sex drive in your 50s. You should,
Yeah, and it's treatable. Unfortunately, a lot of providers maybe aren't educated on the pelvic floor, or they don't know that it's not just something that comes along with having female anatomy. Like, you don't have to pee your pants after you have kids. You don't
Yeah.
have to have pain with sex. And it's not just about having a glass of wine and relaxing beforehand. It's like an actual physiological musculoskeletal dysfunction that we can treat.
That's amazing because I'm in my 50s and I have a lot of clients and a lot of friends in my age group that area starts to be a big problem. And it feels like you're diminishing, like it's a thing that you used to enjoy that is like going away now. So do you think that it's possible to regulate pelvic floor issues without surgery, without medication?
Absolutely. Medication is helpful in some cases, like interstitial cystitis is a condition that causes pain when your bladder is filling. In a case like that, you might want a medication that helps you reduce pain, like while we're working on strength and the other things.
Mm-hmm.
But often with lifestyle changes and physical therapy, we can get people to a point where they don't need the medication anymore. And as far as surgeries, there are some cases where that's necessary as well. Like if there's a severe case of prolapse, especially as women age, if they've had children, sometimes maybe the prolapse just has gone too long and it's no longer fixable with just physical therapy. But still, in those cases, if you have a surgery and then don't pair it with strengthening, then sometimes the surgeries fail. Pelvic floor therapy is even necessary in those cases where surgery happens too.
So it sounds like it's almost like PT for your pelvic floor after.
Yep, exactly. Those muscles are the same as other muscles, but just accessed differently.
Yeah, they need attention too.
Yep.
Yeah.
But for most cases, you don't need medication and you don't need surgery. A lot of things can be healed just with strengthening and proper coordination.
When a woman is going in to go talk to her doctor and she's saying, hey, I'm having some of these pains, and she's going through the steps that they're saying, how does she know when she needs to advocate for herself that she wants to go to a pelvic floor therapist?
Well, if you're having any of the symptoms that I mentioned, like pain or urinary or bowel symptoms or heaviness, if they don't mention pelvic floor therapy, you should definitely ask for that. Advocate for yourself and ask for the most conservative form of treatment. So that's the first thing. But also, when you go see your provider, unfortunately, there are some physical therapy practices that don't incorporate all of the strengthening type things, and maybe they're more manual based. So even when you're going to your physical therapist, advocate for yourself there and ask for functional exercises. Be very active in your own care. Like, you have to do the exercises at home and ask for practical application of the things that they're teaching you.
Creeped around on your Instagram a little bit to look at some of your stuff that you had on there, and it felt like it was really helpful. Like there was some, like you were actually using your own body and kind of showing how like even your posture and the way that you tilt your pelvis could be a big help. And so for me, kind of watching that and getting some tips, it sort of opened up this new thing that I'm really interested in about myself. Because of course I want to take care of, like I want to maintain muscle as I age, I want to maintain bone, but I definitely want to maintain that area of my body as well and feel confident. I want to feel like I can count on it,
Mm-hmm.
because it's such a bummer when you're like, oh, I got to go home and change. I can't tell you how many times I'm like, we're getting ready to go somewhere. We get in the car, I sneeze, and I'm like, turn the car around. I got to go change my pants.
Yeah.
It's
A
such
lot
a
of my patients like don't leave the house without a change of clothes because they're worried about those things, but
yeah.
you should be able to depend on your pelvic floor.
I know you probably mostly deal with women in middle age, but do you ever see younger kids, or is it something that we need to start talking about our daughters with?
Yeah, sometimes when kids have urinary symptoms, it's pelvic floor based as well. So if they're bedwetting or if they're having trouble with urinary frequency, like I know a lot of young girls have to go very frequently or they hold it for too long, those things can definitely be treated by a pelvic floor therapist as well. And unfortunately, I think that a lot of it stems from girls seeing what they think a female body should look like and then like sucking in their bellies all the time. That
Mm,
causes tension and that can cause urinary symptoms, especially and pain and other pelvic floor dysfunctions. So yeah, all ages can benefit from pelvic floor therapy.
interesting. And does insurance generally cover it, or is it something outside of insurance?
Insurance generally covers it. Yeah.
Really? That's
Yeah,
cool.
you have to jump through some hoops with insurance.
Yeah.
So if you're just trying to see a pelvic floor therapist for preventative reasons, I think that's a totally fair reason to see a pelvic floor therapist, but your insurance might not cover it in that case. But if you tell your provider who's referring you to pelvic floor therapy, all of the symptoms that you're having, then the insurance usually covers it.
Oh, that's so cool. Okay, and then is there anything like if you had a message that you would send out to women with regards to their pelvic floor and their health in that area, what things would you say?
I just want women to know that everyone can benefit from pelvic floor therapy. Like, even if you don't have symptoms, get an appointment to get checked out just to see if you could be strengthening better, or if you could be taking care of your body better to prevent symptoms in the future. And I also want people to know that it's accessible. We were just talking about insurance, and often insurance covers pelvic floor therapy. But there's also other resources. Like I have a newsletter and I post a lot on Instagram, lots of free tips and tricks, and just start reading about some things and then maybe you actually have some symptoms you didn't realize were pelvic floor symptoms.
Okay, tell me one more time where the people can find you.
You can follow me on Instagram at doc.jadejette. I have a newsletter where I send out weekly just free information about your pelvic floor education because knowledge is power.
Yeah.
And if you want to work with me more closely, I do one-on-one coaching, give you some accountability for your strengthening program, and teach you how to specifically activate your pelvic floor based on your and you can DM me on Instagram if you're interested in that.
Hey, Jade, thank you so much for being here. I felt like I really learned a lot, and I feel like I've opened up a window in my brain to start thinking about what ways that I could take care of myself in that area. So thank you so much. And I'm looking forward to following your journey and watching the things that you do because you do give so many great tips. So thank you for being here.
Thanks for having me.